So I was asked to participating in a session which was entitled Leaders, Innovators, the Athena SWAN Act. For those who are not familiar, the Athena SWAN Act is to promote and help women in science with their career and with their mentorship. And the session was with 3 women. And it was to, I think, underscore that women can also be leaders and innovators and have a place in science. And so the 3 of us gave examples of what we were seeking in the next years. And so I was asked, and I chose 2 subjects, 2 challenges of personalized medicine, which I thought were very linked. The first one was to push the real name personalized medicine from the reduced, let's say, stringent word of precision medicine. And the other one was to promote education on personalized medicine, which has been a very strong initiative of EAPM since at least more than five years now. So for me, coming from precision medicine to personalized medicine is integrating more than just the genome. It's integrating all the data from a patient, whether it's from its genome, and I highlighted the fact that only 2% of our genome codes for proteins, which we believe are the only actors of diseases when they're abnormal. And there's still 98% of the genome which can also now, science shows, is also implicated in diseases. So going to whole genome will allow us to discover other sources of diseases, abnormalities and biomarkers, but we need to link the genome data to the patient data. And this requires that there's a European effort to sit down and share the expertise that all countries have. There's a lot of countries who have started initiations. The National Cancer Institute in France has participated in an international consortium since 2008. The ICGC, which is genomics. There's the UK program, 100,000 genomes. The French has a national French program on genomics, which helps to set up how we can tackle genomics in a routine setting for all diseases. So most of the member states, like Estonia, are really working strongly on genomics and patient data. However, there's still difficulties in getting all this data together. And what I finished by talking on this chapter was that I believed, and I think some of the member states which met together in October in Brussels working on cancer and personalized medicine, aimed at saying that we all had experiences, but if we all sat down together, we would probably have results faster. So this links to other initiatives, and the MEGA initiative is certainly something which has a goal, which is 1 million genomes shared together across Europe. It's a goal. A number is always important. I definitely, as I said, link it to personal patients' data. And if we really can share expertise, I think we will not start again in each country to go over all the hurdles which are complicated. And so one of these hurdles, I believe, is that people are not sufficiently aware of what personalized medicine is, what we need to do a good personalized medicine. I always take the example, I'm a doctor, that when I treat a patient, I do personalized medicine. I integrate by looking at him, his age, if he's sitting with a parent or something, that his social life, his job, and I do not give the same treatment, and I not do react the same way, depending on what the person himself or herself is. Data is too complicated now, and my mind and my experience is not sufficient to take all the data in my own mind, and so I need to have integrated data information which can help me. And it won't be me, it will be the other doctors and the new doctors and the new researchers which will follow me, which will need to be able to have these tools which will lean on the data that has been integrated and which is already accumulating. And I think that if we teach people what is implied by personalized medicine, then maybe we can reduce these barriers, which we still, I think, are cultural, are not so much that patients are scared that their privacy is being impeded. Regulatory issues are certainly there, but I think in some countries they've managed to go over certain hurdles. Other countries have gone over other hurdles, and so if the member states sat down, it would be, I think, a good progress. But this goes through education and communication on what personalized medicine is. And so EAPM has been launching educational programs on personalized medicine. The first summer school I participated in initiating this, it was done with more than 10 European associations. It was really interdisciplinary, and it was addressed to all healthcare professionals, and the 30 people who were there came from everywhere: psychologists, doctors, engineers, biologists, pharmacists. So it really, I think, is necessary. And I believe the two are connected. If we communicate on what personalized medicine is, then I think people will understand the need to sit down and share the experiences.